Greetings and thank you all for joining us today for this webinar. I am Isabelle Chaudry, and as the Senior Policy Manager at the National Women's Health Network, I lead our organization's work to ensure that the safety of cosmetic and personal care products are safe. So before we get started, I just want to provide some house cleaning rules. The webinar will go to about 2:45. And we will reserve the last 5-10 minutes for participants. And if you all see at the bottom of the screen, there is a Q&A feature. So just feel free to save your questions for the very end, and you can direct your questions at any one of the participants who will be speaking. And I will read out the question and the participants will answer. So the goal of this webinar is to provide information about toxic ingredients in cosmetic and personal care products, highlight the connections between the dangers of toxic ingredients in cosmetic personal care products and women's health, and then link those to the impacts that those products have on overburdened populations. We also want to discuss how to access safer products. So we have 3 expert panelists with us today. First, we have Dr. Zota. She is an associate professor with the Department of Environmental and Occupational Health at the George Washington University Milken School of Public Health. Then we have Nneka Leiba. She's the Vice President of Healthy Living Science at the Environmental Working Group. And then lastly, filling in for Alexandra Scranton, we have Jamie McConnell. She is a Director of Programs and Policy at the Women's Voices for the Earth. So just starting with Dr. Zota, I will allow you to introduce yourself and just tell us how you got involved in this work, and then we can go into some of the questions that I have for you.
All right, can everyone hear me okay? Yep. Yeah, thumbs up, okay. So thank you for inviting me to this very important conversation. And just a little bit about myself. So I'm an environmental health scientist. As you mentioned, I'm based at George Washington University, Milken School of Public Health, which is right in Washington, DC. And broadly, my work seeks to motivate and secure environmental justice and improve health equity, and using several levers of change, including science policy, as well as clinical practice. So that's like the healthcare setting. And I do that, some of my science itself really tries to identify novel pathways linking social status, whether that's around socioeconomic status, race, gender, sexual orientation, thinking also about how these different social identities compound when thinking about discrimination, and linking that to environmental exposures and specifically women and children's health. So these are kind of the threads of my research. I would like to also say I do science, I teach, but I'm also really equally committed to science research translation and science communication, because it's one thing to do good science, but if nobody knows about it, then nothing will change. And so I, write op-eds, write for the kind of general public, also do a lot of speaking in front of decision makers at the state and federal level, and that's how I know several of you. And so I got involved in, I've been working with consumer product chemicals for over 10 years now, both interested in characterizing exposures in vulnerable populations, but identifying underappreciated sources of exposure. And so I been studying phthalates and parabens for a while. My own research determined that certain cosmetics, such as feminine hygiene products, were not only a source of these exposures, but were also responsible for one reason why certain women of color have higher levels of these chemicals in their bodies. But I didn't want to stop there because then that puts all the emphasis on the individual, and we'll get into this a bit later, but I think it's important to think about the social context in which women, but as well as men and children, are using beauty products. Take a step back to think about beauty norms, beauty culture, how that all is kind of historically, that has developed and how it's perpetuated. So that's just a little bit about, how I got into this, but the kind of the framework that I'm trying to encourage others to think about when they're thinking about underregulated cosmetics, health concerns, especially in overburdened communities.
Thank you. Thank you for providing that. So I'll just go into the questions now. So my first question is, we know that nearly 80% of hair products aimed at Black women contain chemicals linked to cancer, infertility, obesity. We know that up to 78% of hair relaxers contain endocrine disrupting hormones, including parabens. And then it's well known that Black women experience one of the highest rates of preterm births, preeclampsia, fibroids, and a host of other maternal health issues. So having personally lobbied on this issue in Congress for months, I've noticed that there isn't a robust discussion around cosmetics and its impacts on maternal health. Can you just go into that a little bit more and discuss the ways in which unregulated cosmetics intersect with reproductive health and reproductive justice?
Sure. I think it's a great question and one that is very timely. So I would say generally in the space of environmental epidemiology, women's health is just an understudied area. So, traditionally maybe we have studied pregnant women, but usually the emphasis is on the new, the developing fetus, the newborn, the child. And only until recently have folks been focusing more on the health of women themselves, both during pregnancy as well as during postpartum, both in the context of maternal mortality, but also there's new research suggesting that what happens during pregnancy can have big implications for the woman's health down the road during midlife. So certain pregnancy complications can lead to greater risk of type 2 diabetes or cardiovascular disease. So, that is happening in it of itself. How these issues intersect, I think there are a lot of ways that environmental justice and reproductive justice intersect. And so, I think this is one of those areas. Just for example, this isn't necessarily a cosmetic example or, related to cosmetic contaminants, but recently the National Toxicology Program released a report suggesting that air pollution increases the risk of pregnancy-induced hypertension. And why that's important is because high blood pressure during pregnancy and also in postpartum is one of the major complications leading to maternal mortality. We also know that air pollution is it's one of the most well-studied contaminants, but it is also incredible. I mean, there are stark racial, ethnic, and socioeconomic differences. So poor people of color have much higher rates of, experience air pollution. So, that's an example of one particular way that, the environmental epi literature does intersect with the mortality crisis our country is facing, especially Black women. I think some other ways of thinking about it is, at least the way I think about toxic exposures from cosmetics in overburdened communities, structural racism is one of the root sources. And, that is also one of the root sources of the maternal mortality epidemic. So that's another way they intersect. And then lastly, my specific research is really delving into uterine fibroids and gynecologic complications, and really getting into kind of the nitty gritty of how some of these chemicals in cosmetics actually affect the epigenetic regulation of these fibroids. And so I'm actively working on that. And fibroids, like high blood pressure, these are some of the complications, some of the issues that lead to more complicated pregnancies that, then contribute to maternal mortality. So I think there is a thread there. I don't think anybody is gonna, anybody would start saying that the reason this crisis exists is because of toxics and cosmetics, but there are these important intersections that I think we need to be making more generally between reproductive and environmental justice.
Yeah, because like I mentioned, I've been in this space for several months now, and this space, specifically the cosmetic policy space, and I've attended meetings like reproductive health meetings and forums, and I haven't heard this issue come up as one of the ways to close some of the disparities. I know there are other external factors like you mentioned, structural racism, discrimination. But thank you for answering that.
And I would just say that I think it takes people perhaps like yourself to actively make some of those connections for others. And there are also people out there, scholars, clinicians, saying that that a lot of what's driving these disparities, it's not just what's happening in the healthcare setting, that it is social, environmental factors. So I think it just takes people to help bring these issues together. Oh, you're on mute, I think.
Isabella. Yep, so very true. And just piggybacking off of that, I just want to go into another question. In your article, The Environmental Injustice of Beauty, Framing Chemical Exposures from Beauty Products as a Health Disparity Concern, you highlight certain external factors, specifically 3 external factors that I think are really important to continuing this conversation. So you highlight external factors such as colorism, hair texture, and odor discrimination for examples of disproportionate beauty product exposure among overburdened or vulnerable populations. Can you just unpack that a little bit more, those 3 external factors?
Sure, and I will try to be brief. It is a very, I think, very kind of involved argument, and so I encourage people to go read that piece directly. It is open access, so anyone can access it. But I'll start with kind of talking about how these may affect the beauty rituals of African American women, but only to caveat to say that a lot of these, particularly like colorism, and even hair texture, I mean, these are global issues that affect many different women of color. So, this is also playing out on the global context. But just for the sake of being brief, I think you have to kind of take a historical context and go back to the time of slavery to realize that certain phenotypic traits, including darker skin, including hair texture, as well as odor or scent, were used to differentiate African Americans from Europeans and to justify their oppression and dehumanization. So, kind of over the last several years, addressing or trying to negate some of these stereotypes have been, ways, kind of have been avenues for social acceptability and also importantly, social mobility. So, these are, these are almost forms of, they all kind of go back to structural racism, and they're all, forms of discrimination based on different phenotypic traits. And so that's what they have in common. And so, the beauty rituals, many of which get passed down from generation to generation, a lot of these are in response to these social forces. And then they've been sometimes amplified by, targeted marketing. So, leading to very elaborate, often expensive beauty practices, often that, require the use of more toxic products, whether it's chemical hair straighteners or fragranced vaginal douches or, skin creams that contain mercury. I would say the latter is less commonly used among African American women and more commonly used among African immigrants, Indians, East Asians, Latina women. So a little bit more on the global, kind of the global context. So really what we're trying to do here is really link social and historical forces that drive our current day beauty culture that really has historically discriminated against women of color, and explicitly link that to the products they use and the health implications of these more toxic products.
Thank you. I will reserve this last question for later on if we have more time. Thank you for being so thorough in your response. So then I will now pivot to Nneka Leiba. So I'd like you to introduce yourself, tell us how you got involved in this group, and how the Environmental Working Group's mission is related, and then we can go into questions.
Yeah, certainly. Hi, my name is Nneka. I am the Vice President of EWG's Healthy Living Science team. I am an environmental health specialist by training, and I've been at EWG for more than 14 years, or about 14 years at this point, and have been working on ingredients and toxicity of personal care products since then. But under my umbrella, I also look at the ingredients and toxicity in a number of consumer products. The Environmental Working Group is a nonprofit research and advocacy organization, and we try to empower people to live healthier lives in a healthier environment. And by that I mean educating consumers, people in general, about the ingredients that they are routinely exposed to, why they're exposed to those chemicals, meaning the lack of regulations or other situational reasons, and then how they can avoid those chemicals. So our mission is really to empower people to take the power back if nobody else is overseeing the safety of these ingredients, and sort of taking that power, feeling that power, and changing the markets themselves, which is what we are in fact doing.
Thank you. So my first question is, so through the Environmental Working Group's article titled "Big Market for Black Cosmetics, but Less Hazardous Choices Limited," you and your colleagues introduced the research that has been done on over 1,000 beauty products. Mm-hmm. And in the analysis, we see that fewer than 25% of the personal care products marketed to Black women rated well in the EWG's Skin Deep database. Mm-hmm. So just looking at the Skin Deep database, what would it take for a product to be classified as low hazardous? And I guess for the participants, you can also go into like what exactly is the Skin Deep?
Yeah, so I'll start with a little background on Skin Deep. Skin Deep is a freely accessible online resource that EWG has that we launched in 2004, and it rates the hazards or the toxicity of ingredients in personal care products. So currently we have about 80,000 products that we have rated or scored on a 1 to 10 scale, 1 being the products with the fewest hazards and 10 being the products with the most hazards. And the reason that we decided to launch Skin Deep and why Skin Deep has grown is because of lack of regulations around personal care products. So we wanted to highlight that ingredients linked to harm and ingredients that have been banned or restricted in other countries are widely used in products in the US. For a product to score well in Skin Deep, like I said, it has to have little to no hazards, or the ingredients can't be linked to harm. So as you mentioned, Isabelle, we released a report in 2006 that looked at personal care products specifically marketed to Black women. And one of the reasons we did that was because we wanted to draw attention to those products and look to see if ingredients in those products differ drastically from ingredients in other products, especially because the health disparities between women of color and other women does differ. So we collected more than 1,100 products marketed specifically to Black women, and we found that fewer than a quarter of them scored well in Skin Deep, meaning in the green range, scored 1 or 2. When we looked at the wider universe of products in Skin Deep, so products marketed to all of the other demographics or just marketed generally, greater than 40% scored well. So when you look at that, it's less than a quarter of the ones marketed specifically to Black women scored well versus not quite half, I won't push it, but greater than 40% to a wider demographic. So that disparity in and of itself was eye-opening to us. Our analysis showed, to no surprise really, that there were certain categories of products that scored worse than other categories. And these were categories of products that women of color used routinely. So they included hair dyes and hair straighteners. The average score for hair dyes that we looked at in that report was 8.1. And the average score for hair relaxers was 8.1, and for hair dyes was 7.9. So both of them were roughly an 8, and again, it's a 1 to 10 scale. So again, that wasn't shocking given other research that has been done in this area. Hair relaxers and dyes often contain caustic ingredients like sodium hydroxide, sensitizing chemicals like phenylene diamine that can trigger allergic reactions in people that are otherwise completely healthy and had no previous issues with allergies. They also contain, as you mentioned, Isabelle, parabens and other endocrine disrupting chemicals, and parabens have also been linked to cancer. We also know from a recent NIH, National Institute of Health study, that hair dyes and straighteners have been linked to an increase in breast cancer risk. And interestingly, in this study, Black women who used hair dyes were 6 times more, at a greater risk of more than 6 times to get breast cancer than the other women in the study who use these products. So I think the one thing I'd be clear of, though, is that these ingredients aren't unique to this product category. These ingredients aren't unique to products marketed to Black women or women of color. But what is unique is how much of these products that our demographic uses. So Black women and other women of color use more cosmetics in general than a wider audience, especially hair products. And definitely when it comes to hair straighteners, we obviously use, women of color use a disproportionately higher amount of hair straighteners, which means that women of color are at an increased risk of exposure to chemicals that can affect fertility and can cause cancer, and therefore we're at greater risk. But while not enough people are talking about the risk of cosmetics in general, certainly not enough people are talking about the disproportionate risk of certain demographics to ingredients in this product type.
Thank you for providing that explanation. Yes, we do know that Black women use these products, hair products in particular, at a much higher rate than other demographics. And as Dr. Zota mentioned, some of it has to do with the structural racism, structural discrimination, and we know that it's not uncommon for Black women to be fired from work for not having their hair in a certain way, or having a natural hairstyle, or being, or kids being asked to cut their natural hairstyles like locks in order to participate in activities. So I'll just go into my next question, which is going a little bit more into some of the chemicals that you mentioned, but specifically if we look at phthalates, which have been linked to obesity, increased risk of diabetes, increased risk of metabolic syndrome and cardiovascular disease risk, as well as preterm birth, preeclampsia, and gestational diabetes. How can we avoid using these products that contain such dangerous chemicals if we're just, if our products are not necessarily, if our products are different, or being that we use more products than other demographics? And I'm saying we as in Black women and other women of color.
Yeah, and as you were reading off the health effects linked to phthalates, which are spot on, you have to wonder, how are these still allowed in not only personal care products, but phthalates are widely found in consumer products. So phthalates are plasticizer chemicals. For people that aren't aware, they add flexibility to products. So they're used in a lot of plastics, and they're used in personal care products. The CDC has tested and found phthalates in almost all of the Americans that they have researched. So again, it's a group of chemicals that are prevalent. In personal care products, phthalates are found in some nail polishes, and they're found in fragrance mixtures. In the case of nail polishes, it's easier to avoid phthalates because they would be listed on the ingredient list. As I'm thinking about this, I'm like, how easy is it to read one of those ingredient lists on nail polishes? But at least it's there. If you go in with your magnifying glass, you can figure out a way. The issue becomes in fragrance mixtures. When phthalates are used in fragrance mixtures, they don't have to be labeled at all. So there are a wide array of products, from personal care products to cleaning products to feminine care products, that use that term fragrance. And that was an ingredient that we saw commonly in products marketed to Black women. But we know that it's commonly found in all products in general. But as Ami said, there is that whole scent connotation and fragrance. But there's a loophole in the law that allows manufacturers to use the term fragrance rather than disclose the specific ingredients in their fragrance mixture. So this umbrella term, fragrance, can hide any number of up to 3,000 ingredients, including phthalates and other common ingredients of concerning musks, ketones, etc. So again, to your question on how to avoid that, it would mean that you should avoid, and this is, you need to avoid products that use the term fragrance. This doesn't mean avoiding fragranced products, but what you should look for is a product that has disclosed its fragrance ingredient. It is impossible to be an educated consumer making a choice about a product if you don't know what's in it. And there's no way to know what's in a product if it says fragrance, because it is basically a black box. When I started this work 14 or so years ago, it was nearly impossible to find products that didn't use that term. The good thing, and as I alluded to earlier, as we continue to push the markets and empower ourselves, we are seeing more products or more companies now starting to disclose what's in their fragrance mixture.
Thank you. Thank you so much. In the interest of time, I will reserve my last question to if we have time later. So now I will move on to Jamie McConnell. I'd like for you to introduce yourself, tell us how you got into this work, tell us about Women's Voices for the Earth's mission, and then we can go into your questions.
Great. Yeah, so I'm stepping in. My name is Jamie McConnell. I'm the Director of Programs and Policy with Women's Voices for the Earth. And I'm stepping in for Alexandra Scranton, who was supposed to present on this webinar on behalf of WEAVE. She's our Director of Science and Research. And unfortunately, she has the flu, so she really cannot be here. So she did kind of prep me on some of the responses to the questions. So, but I've been at the organization for 12 years. I've been mostly focused in those 12 years on working and passing laws that increase disclosure of ingredients in consumer products, and also supporting laws that would require more rigorous safety standards for ingredients used in personal care products, cleaning products, intimate care products, also known as feminine care products. And Women's Voices for the Earth works to eliminate toxic chemicals that impact women's health in particular, and also increase disclosure of ingredients in these products. And we really try to create avenues for women to raise their voices on these issues. And we are actually celebrating our 25th anniversary this year. So that's exciting.
Yes, thank you. So in a fact sheet in Women's Voices for the Earth, the organization focuses on unmasking the impacts of toxic chemicals on salon workers, which are one of the vulnerable, or I should say overburdened population. And so the fact sheet states that over 60% of salon workers suffer from skin conditions on their hands. Hairdressers and nail salon workers have decreased lung function, and some studies even show that there's an increased risk of miscarriages. So with such awful and harmful health outcomes, how come we have not seen, I guess, progressive policy changes related to salon products and salon work habits?
Mm-hmm. Thank you. Yeah, so when we started work on salon products in 2007, we focused particularly on nail salon products because they commonly contained what we call the toxic trio, which is butyl phthalate, toluene, and formaldehyde. And we looked, and when I say we, this is Alex, we looked for research on how this chemical exposure was affecting the health of nail salon workers. And what we discovered was that there was very little research at all looking at the health impacts. And so we issued our report, which Alex co-authored or authored, called Glossed Over. And the intention of this report was really to highlight and reflect on the fact that this is a largely female, largely women of color occupational group that was being ignored by public health researchers, despite, you know, the many challenges that they face in the workplace, not only from, you know, chemical exposure, but, you know, there are other issues in the workplace as well that can impact their health and well-being. So yes, you know, there are major barriers, sexism and racism to start. And also in some communities, we have, you know, there are language barriers, which we feel has led to the under investigation of these workers. So we followed up our 2007 report, Glossed Over, with a report in 2014 called Beauty and Its Beast. And that looked at the literature for research on impacts, health impacts on salon workers. And so we expanded it to not just include nail salon workers, but from hairdressers as well, because we were hearing from a lot of hairdressers that they were experiencing health impacts on the job. And we did find more data, but you know, a lot of the data wasn't really focused directly on that industry, on the salon industry. And what we were kind of more likely to find was occupational health and mortality studies that looked at all workers of all occupations. And that highlighted those disproportionately affected by certain diseases. And salon workers frequently came to the top of the list. So for one example, we found a study on hypospadus, which is a birth defect of the penis. And there were disproportionately more women who gave birth to babies with that birth defect from the following industry: agriculture workers, laboratory technicians, and hairdressers. And we, you know, when we think about this, we kind of expect to see heavy duty chemical exposures, unfortunately, in the agricultural industry and in laboratory work. But I know it was a surprise even for us to see that many hairdressers were on par with these workers. You know, so thinking about some of the barriers, I think, you know, there's been this general assumption that cosmetics are safe. So there hasn't necessarily been, you know, the political will to fully challenge that assumption. I think that is changing. You know, I think another barrier has been access to ingredient information because of a loophole in federal law. There are no requirements federally that manufacturers have to disclose ingredients that are used in salon products, unlike retail cosmetics where you can go in, look at a label, you won't see fragrance, as Nneka mentioned, it'll just say fragrance, so you won't see the fragrance ingredients, but you will see the other ingredients that are used in that product. That hasn't been the case for salon workers, although recently we worked with breast cancer prevention partners and Black Women for Wellness and the California Healthy Nail Salon Collaborative to pass AB 2775 in California. And that's the first law in the nation to require disclosure of ingredients in professional salon products directly on the label. I don't think that goes into effect until 2021, but once that starts happening, we're going to have a lot more information about what salon workers are being exposed to. So that definitely helps advocates and researchers make the case for safer products. It also will give salon workers more of a choice of what they want to be exposed to, because they are going to have that information to ingredient information. I also think that when you have full disclosure of ingredients and products, it provides more of an incentive for manufacturers to find safer alternatives. And it can help create more innovations in green chemistry as we try to create, as manufacturers try to look for, instead of wanting to disclose a nasty chemical like toluene, maybe they can find something that will have that same function and invest in more R&D of an ingredient that will have that same function but won't be as toxic to salon workers. I also wanted to mention the work of the California Healthy Nail Salon Collaborative. We co-founded the National Healthy Nail and Beauty Salon Alliance over a decade ago with the California Healthy Nail Salon Collaborative, and they're doing really wonderful work in California focused on nail salon workers, focused on the health and safety of nail salon workers. So maybe I'll just stop there.
Okay, thank you. I'm just thinking, as you mentioned, some of the legislation that has been passed in the state. Can you think of other advancements that have been made in reducing the amount of harmful chemicals in salon products? I'm asking because it just seems like such an urgent issue. These are products that are harmful, and the workers are using them on a daily basis, more frequently, as you mentioned, than other occupations. Or do you have like other suggestions for policy changes that need to be made?
Yeah, I do. And this kind of, I guess, gets into your third question, but what's really needed is we need personal care products and salon products. Salon products are defined as cosmetics under federal law. And what we need is stronger legislation that all ingredients in cosmetics, and when I say cosmetics, I'm also, again, talking about professional salon products, that they have to meet a certain standard of safety. And that standard of safety is developed with vulnerable populations in mind. So pregnant women, people of color, workers, like salon workers. And there's been a bill that's been introduced called the Safe Cosmetics and Personal Care Products Act by Jan Schakowsky. And that really represents, Women's Voices for the Earth thinks, the gold standard in what we need in cosmetic safety legislation. Because really, unfortunately, until we have, until manufacturers are required to do it, we're not going to see a huge change across the industry. And I think we have seen, more retail, natural cosmetics or products that are marketed as green, and in some cases are safer in the retail sector. And I just don't see that as much in the salon industry. Certainly there are some brands that offer greener products, but one of the tricky things with the salon industry, I think, is that these are products that are meant to, they're stronger than what you would buy on the retail shelf. They are meant to straighten hair or curl hair or color hair. And in some ways, to find there needs to be more substantial R&D invested in finding ingredients that will provide that function, but not be toxic to this industry.
Thank you, Jamie. Those are very important points, and policy, I guess, policy initiatives and policy in ways that we should be thinking about coming to solutions for this issue. In the interest of time, I guess we can go to questions now from the participants, but
Isabelle, can I add one thing to that policy discussion? Well, I guess two things. I was wondering if, I don't know if Jamie touched on the Feminine Care Right to Know Act that passed in New York that you guys were involved in. Maybe you wanted to mention that. And the other one, I just wanted to mention that I think, especially as we talk about, you know, what our policy interventions look like, especially for overburdened communities. And so I think we have to address, you know, the discrimination and societal norms. And California just recently became the first state to make discrimination based on hair discrimination illegal, both in workplaces and K through 12 educational environments. So I think that's another types of policies that we need to encourage, in addition to, you know, an overhaul of how we regulate cosmetics and personal care products. So just wanted to add that. And Jamie, did you mention anything about the feminine care products?
I didn't. So that was, and thank you for bringing up that California law that recently passed on hair discrimination. I think one also may have passed in New York, but yeah,
I think New York City.
Yeah, New York City. Yeah. But that came to mind as you were talking. So in last year in October, Governor Cuomo signed into law a bill that requires disclosure of ingredients in menstrual products. So pads, tampons, cups, and period underwear. So thank you for mentioning that, because that was the first in the nation to require disclosure of ingredients for that product sector. I also just wanted to mention a program that the California Healthy Nail Salon Collaborative has in California called a Healthy Salon Program, and that provides incentives for salons who meet certain criteria for what a healthy salon looks like, and that includes using less toxic products. So that's one, and the Healthy Salon Program has been adopted by Oakland, I think San Francisco, and some other municipalities in California. So that's one way that they're addressing the problem. We've also seen manufacturers come out and market their products as 3-free or, free of formaldehyde, the toluene, and W-butyl phthalate. But the problem is, without any kind of safety standard they have to meet, there's no assurance that what they're using instead of some of these well-documented toxic ingredients, like the toxic trio, that they're going to be any safer, which is called regrettable substitution. So that's also an issue.
Thanks, Jamie, and thanks for bringing that up, Dr. Zota. I do have a question, or we do have a question from a participant, and this is for any of the presenters. What are your thoughts on clean beauty products? Do you think clean beauty brands are doing enough by avoiding harmful chemicals?
This is Nneka. I can take a stab at that. So, one of the things about personal care products that we've mentioned a few times is that there are not a lot of regulations. One of the things that aren't well regulated is claims. So natural right now doesn't have a definition, and so too doesn't clean. So clean doesn't necessarily have a definition. EWG has a program called EWG Verified, where we have defined what clean is. But our definition of clean may not be the same definition that other companies use. So although some companies may say that they're clean, they may still use some ingredients of concern. So I think it really is up to the consumer or people in general, to do a little bit of research into the companies that are saying that they're clean, and looking at the ingredients that they're used. And maybe their definition of clean aligns with your definition, which is fine. That's completely fine. But you can't just look for the terms of clean, natural, or anything. You do have to kind of look a little bit more into it. So from our perspective, some companies could be doing more that say that they're clean. There's a spectrum of quote unquote clean. It's good to see that there are more people trying to go in that direction because it means people are asking for it and people are pushing the market in that direction. But unfortunately, now we're seeing a little bit of a dilution of the term because it's not as stringent of a definition as we would ultimately want. So some companies could be doing better. Obviously EWG thinks the verified standard is the gold standard in clean for beauty. But at the end of the day, unfortunately, it means that we still have to look at labels and still have to do a little bit of research because we can't necessarily always just look for a term like clean or natural and feel confident that it means something.
I just want to add a couple of things from what's been done from a research perspective. I mean, one, I think there is still a lot more room and need for data. For example, even the natural hair care industry, specific to the Black community, those products I think need a lot more investigation. And we are actually planning to do some of that with a collaborative that I'm part of with Black Women for Wellness, Silent Spring Institute, and researchers at Occidental College. So we're going to be trying to fill some of those gaps. But to the two studies that I kind of want to bring up, that have started looking at how effective is if you just read the label in terms of being able to reduce your exposures. So Silent Spring Institute has done some testing and has generally found that, if products say they're paraben free or phthalate free, that they indeed do have lower concentrations of those chemicals. There could be a lot of other chemicals that could still be, for example, endocrine disrupting chemicals or contribute to asthma risk or so forth. But that generally reading the products, there is some truth to if it says it doesn't have a chemical. The other study I want to just raise up is there was an intervention study done by a scientist at UC Berkeley, and they looked at Latina teenagers, and they gave them products that were quote unquote cleaner, and they didn't test the products, they just based it off of reading the labels. And generally after, I think it was maybe a 1-week intervention, they found that most of the chemicals they were looking at, specifically triclosan, parabens, phthalates, were reduced in the bodies of these teenagers by 30 to 50% after 1 week. So, they didn't go down 100%, they didn't go down to zero, but generally this short intervention, which focused on personal care products and cosmetics, did lead to measurable declines in the body burden, of the levels of these chemicals in their body.
And that was a great study. Thank you for mentioning that, Ami. And the researchers actually used Skin Deep to find products without the ingredients of concern. And so it just shows you that we are able to make a difference in our overall body burden by using tools to choose products with fewer ingredients of concern, and that the levels in our bodies, sometimes depending on the chemical, can be affected by small changes.
Thank you. I will just do one last question. There's a question about hygiene products, which is somewhat related. Technically, hygiene products don't fall under cosmetics per se, because they're considered devices for some reason. But the question is, can you talk about the hygiene products? What do we know about their impacts on women's health what products are safer?
I mean, I can get started. I know that Leiba is actually one of the leading voices on hygiene and feminine care, if that's what we're talking about for hygiene. A lot more studies are showing that feminine care and hygiene products are loaded is a word that I don't like, but are heavily contaminated with, or ingredients of concern are heavily used in feminine care and hygiene products, including phthalates and parabens, and in some cases, why I had said contaminated is pesticides, and VOCs, or volatile organic chemicals, all chemicals that have been linked to harm. But because of how some of these products are regulated, so they fall under medical devices, they also don't need to be labeled. But more research is coming out showing that they are a really important source of exposure to chemicals of concern, especially for women who start using some of these products at a very young age and continue for a long time. But they start them at an age where, during adolescence, we're particularly vulnerable to exposure to some of these chemicals. But I know that both Ami and Jamie have done a lot more work on this than I have. I want to hat tip to them. So I'll turn it over to them.
Jamie, do you want to say anything before? I mean, we can't hear you. I think you're on mute. Okay, so she's saying, I mean, I think Nneka mostly hit it, you know, summarized the most important things. This has kind of been a largely ignored industry and source of exposure, because basically we have all these taboos about talking about our sexual and reproductive organs, especially when it comes to women. This is a growing industry. So while things like vaginal douches are less common now, in part because there was, I think, a lot of medical and scientific pressure to discourage women to use douches like internally. But in its like, as a replacement, there's all these other products now, and you know, things like Gwyneth Paltrow's Goop, and you know, she's constantly introducing new products, and basically we have no idea. We don't, I mean, one, there is kind of some new studies that are starting to actually measure chemical concentrations, even in basic things like sanitary pads and tampons, finding very high levels compared to other types of cosmetics and personal care products. Two, we really don't understand what are the implications of chronic exposures, right? This is chronic repeated exposures. Some of these you're using from menstruation to menopause, right? Like monthly, if not more, on our reproductive tract and our gynecologic health. You know, we know that kind of there is some work to show that, you know, the vaginal tissues may be hyper-absorptive when it comes to chemicals, more so than the skin. So there's a lot of open research questions. And I think that, you know, these maybe are really important to women's health. Our other panelists here, you know, I'm glad that everyone here has like put a lot of attention to this, especially Women's Voices for the Earth, and you guys have really helped to kind of make this, you know, an issue at least that some people are talking about and caring about.
Thanks, Ami. Yeah, I think the only thing I'd add to that, because there was also the question of like what products are safer when it comes to hygiene products. And I think part of the messaging we've been trying to include more is that really these products aren't needed. You know, I think women are constantly told that we don't smell right and you need a powder or spray or douche to make you smell good, and so you're attractive. And I think what we've been trying to get across is it's really unnecessary to use. You know, you don't need a wipe or a spray to clean your vagina. Your vagina is a self-cleaning part of your body. And so I think part of the work is, and we're trying to do this better every day, but is to include messaging about the marketing of these products and how they're really just, they're not even necessary. I think if you want the best way to clean your vagina is to use soap and water, you know, a non-fragrant soap and water, something that's gentle. So just add that. So we don't push for alternatives really to these products because we don't think that they're absolutely necessary.
Thank you. And when I said medical devices, I was thinking specifically about menstrual pads, not the hygiene products, which do fall under, certain hygiene products do fall under cosmetics. But thank you, panelists, our expert panelists, Jamie McConnell, Nneka Leiba, and Dr. Ami Zota. And thank you so much to all the participants who are viewing this and who have participated in asking questions. This webinar will be shared widely, and it will be available on our website. So I will just end it now. Thank you so much again. And we'll continue to do the work, of course.
Thanks.
Thank you.
Thank you.
Thank you. Bye.